Hi friends, let's learn multiple myeloma. Multiple myeloma is a blood cancer that affects plasma cells. Plasma cells are a type of white blood cells and the part of your immune system. Do you know, in healthy bone marrow, normal plasma cells make antibodies or immunoglobulins to protect body from infection. What happens in multiple myeloma? Plasma cells are transformed into cancerous cells that grow out of control. These malignant plasma cells then produce abnormal antibody or immunoglobulin. Did you hear about M protein? Yes, M protein are the part of these abnormal antibodies and also it increases in our body. M protein also known as Bence-Jones protein, and remember, high levels of this protein are the hallmark characteristic of multiple myeloma. It's a rare disease which affects bones, kidneys, and your body's ability to make healthy WBC, RBC, and platelets. Do you know there is no known cure for multiple myeloma? Let's see causes or etiology. Healthcare provider and researchers aren't sure what causes multiple myeloma. It's not known, but the potential causes are genetic mutations, environmental factors like exposure to radiation or chemicals, having inflammatory diseases or conditions, example heart diseases, type 2 diabetes, and having obesity. Let's see the signs and symptoms along with the disease condition that develop as a result of multiple myeloma. Some people do not have any symptoms. However, bone pain is the first symptom people notice. These abnormal plasma cells or myeloma cells trigger the destruction of surrounding bone and is likely to break and leads to pathological fracture. And is also causing soft spot in bones. It's called osteolytic lesions. Everyone knows that blood cells are formed from bone marrow. Here, multiplication of abnormal plasma cells or overcrowding will decreases the production of RBC cells and leads to disease condition called anemia. If you have anemia, of course you feel fatigue and breathing problems because you don't have enough RBC which contains hemoglobin who carry oxygen from lungs to different parts of your body. Numbness and weakness, especially in arms and legs. Multiple myeloma sometimes associated with nerve compression, which can lead to numbness in the limbs. And also hyperviscosity, it means increased number of M proteins stick in your blood and leads to weakness and numbness. Next is confusion. This will occur due to three main disease conditions. First one is hypercalcemia. The condition happens when damaged bones releases too much calcium into bloodstream. Kidney failure. Also, abnormal plasma cells make M protein, as we said before, that block filtering process and damage your kidneys. When kidney damages, toxins accumulating are affecting the brain and causes confusion. Hyperviscosity syndrome also related with confusion. What is hyperviscosity syndrome? Is a group of symptoms triggered by an increase in the viscosity of the blood. Frequent infections. Myeloma cells crowd out normal white blood cells which fight in infections. Common myeloma infections are especially pneumonia, kidney infection, sinusitis, and skin infections. Unexplained fever due to bacterial infection. Loss of appetite and excessive thirst. These are mainly due to increased calcium levels in the blood and kidney failure. Nausea and vomiting, unexplained weight loss, bruising or bleeding tendency. Myeloma cells prevent body from producing enough platelets. Other disease conditions associated with multiple myeloma are amyloidosis. This disease happens when abnormal protein build up in your organs. Cryoglobulinemia. This disease condition happens abnormal proteins in the blood called cryoglobulin thicken and clump together at cold temperature. Let's see diagnostic measures for multiple myeloma. It includes complete blood count, mainly RBC and white blood cells numbers, amount of hemoglobin in RBC, and RBC concentration level. Blood chemistry test, creatinine levels. It says how well your kidney work, and calcium levels, albumin levels, LDH level, and tumor marker. A tumor marker is a substance in cancerous cells or healthy cells responding to cancer. Quantitative immunoglobulin test. It measures certain antibodies in your blood. Electrophoresis looks for a protein in blood, and urine test mainly to check presence of Bence-Jones protein. X-rays and CT scan to check any bone damage, and also MRI and PET to detect presence of plasmacytoma. These are single group of abnormal cells. And bone marrow biopsy. It helps to find out changes in your DNA and analyze the percentage of normal and abnormal plasma cells. Let's move to management and treatment of multiple myeloma. Pain medication. People often have significant bone pain. Antibiotics. A weakened immune system can lead to more infections, so doctor may prescribe antibiotics to clear up these infections. Administration of steroids. High doses of steroids can kill cancer cells and reduce inflammation. Chemotherapy to reduce number of abnormal plasma cells. Immunotherapy. This treatment stimulates your immune system so it develops more cancer-fighting cells. Radiation therapy. This therapy kills cancer cells and reduces bone tumors. Stem cell transplant, mainly autologous stem cells transplants and allogenic stem cells transplants. Stem cells are specialized cells in bone marrow or blood that help to produce healthy plasma cells. Here, this treatment replaces damaged or unhealthy stem cells with healthy stem cells in your body. If this video really helps you, please like, share and subscribe my channel. Thanks for watching.